Good morning. Who's going to present the patient today?
I'll present her. So Kristen's a 15-year-old female. She's got a significant past medical history of asthma. When Alexa and I saw her last night, she told us that she, after school yesterday, had an increase in her baseline symptoms of cough and wheezing. So when she got home from school, she did extra treatment of albuterol with an inhaler and seemed to feel better after that. She, through the evening, did okay, and then around bedtime started to have some increasing shortness of breath, did another treatment, and wasn't getting better.
Okay.
Let her mom know, brought her into the emergency room last night. When they got her to the emergency room, she was having a pretty difficult time breathing. They started her with some IV steroids, gave her some oxygen by mask, and gave her some nebulizer treatments with albuterol. She seemed to do better after that, responded to the nebulizer treatments,
okay.
And so they brought her into the floor to be observed overnight.
It sounds like a moderate to severe asthma exacerbation, though, with what you're describing to me. Alexa, did you assess the patient as well?
Yeah, I did. I saw her in the emergency room last night. She definitely had significant retractions, audible wheezing, and we measured her peak flow, and it was about 30% of what we would predict for her height. So I think the other thing that was significant was this was her second trip to the emergency room in 6 months, and I think they were a little scared by everything that happened yesterday.
Yeah, I can imagine that.
Yeah.
Well, why don't we go see her and then we'll make a plan together?
Sounds great.
Okay. Good morning.
Hi.
This is Dr. Heyman. She's one of our pediatric attendings.
Hi,
this
Ms.
is
Toolin.
Kristen and her mom.
Hi.
Hi. So Dr. Craig and Dr. Emerson let me know what happened last night. It looks like you're feeling a lot better today.
Yeah.
Is it okay if I sit down so we can talk a little bit? Sure. Okay. You guys have a plan in place when you feel like your asthma is getting out of control for what to do? Or do you still have more questions?
Supposed to use the albuterol inhaler, but okay. I think it's the timing is an issue.
Okay. Sometimes hard to remember all that stuff, isn't it? Yeah. Okay. Is it okay if I examine you, listen to your heart and lungs?
Yeah.
So if you just sit right there, I'm going to listen to your back. And I want you to take nice big breaths through your mouth. Kristen is feeling better today, but I think we should talk about some concerning aspects of her history. I think that she may be an asthmatic who doesn't recognize her symptoms or potentially even minimalizes her symptoms. So can you guys think of anything that we could do to try to give her some more objective data for when she is having an asthma exacerbation?
Well, down in the clinic, we often use peak flow meters to kind of keep track of a patient's asthma symptoms when they're unable to kind of state them as clearly as we'd like. So I just haven't seen in the past any clear, like, randomized controlled trials that would describe whether that really works in patients.
Great. I think that's an excellent idea.
The medical team believes that Kristen is having difficulty recognizing when to take her medications. Dr. Emerson wonders if there's a randomized controlled trial looking at the use of peak flow meters in patients with moderate to severe asthma. They find a paper using PubMed. It is in the journal Chest, so is available online. A reference to it is on our Data and Abstract page. To get a PDF of the article, search for the PMID on PubMed. The objective of the study is just what we are looking for, and the design showed it was from a university hospital, and it was a single-blind, randomized controlled trial. The study involved 150 subjects, teenagers and adults, who were seen in the ER or clinic for urgent treatment of asthma. 2 of the outcomes looked at were the number of subjects requiring ER visits and the number requiring hospitalization for treatment of acute asthma. As you can see, there were 46 subjects randomized to the peak flow plan and 93 subjects randomized to no plan or a symptom-based plan. 5 of the patients in the experimental group and 33 of the patients in the control group went to the ER for treatment. By the time we get to using our web app, we have already determined that the study is a valid one. That is, it is a blinded RCT with a sufficient sample size. So we start by using the RX calculator to look at the clinical importance of the data. Using the data in the table for the number of subjects requiring an ER visit in 6 months, we enter the correct numbers for the control and experimental subjects and press the Calculate button. This returns the numbers for the CER, EER, relative risk reduction, and the number needed to treat. Copy the clinical parameters to your clipboard, then paste them into the CAT document. Give your CAT a title, then fill in the title and citation for the paper, and provide pertinent information about the study patients, the treatment being evaluated, and the study design. that is, the randomization and blinding. Comment on the study parameters in the comments box, and then write your bottom line about the use of a peak flow-based treatment plan in subjects with moderate to severe asthma, which might be something like peak flow action plan reduced ER visits with a good RRR and NNT, suggesting it is effective and requires little effort in the clinic. Finally, press the Fast Cat button, which returns a completed cat for you to copy and paste into email or notes. So now that you have seen one, try to do one using this same paper and the data for the subjects hospitalized for asthma in 6 months. This is found in the second row of the data table.